Hi there, and welcome to my online symposium on auditory processing disorder. My name is Christine Pickup. I'm a doctor of audiology in Rupert, Idaho. Our clinic is called Matt Harrison Audiology, and it was founded in 2014 when I realized there was a need in our community for whole person hearing health care. I hope you enjoy the presentation and it helps you learn something new about a very important way that our brain uses sound. Thank you.
So welcome again to my presentation on auditory processing disorder. I'm excited to help you learn and understand a little bit about this complex disorder and what it means and how we can actually help you or your loved ones. During this presentation, we're going to review these topics. First, what is auditory processing disorder? Second, how do we hear? And how does APD cause difficulties? Third, how is auditory processing disorder diagnosed? And finally, how is auditory processing disorder treated? I wanted to start by telling you my why. When I founded my clinic, I had had experience where I had been working previously that I saw a need in our community for hearing care that went beyond just selling a hearing aid. So that was part of the plan from the beginning. Specifically, I had seen some patients before I opened my own clinic that came in for a hearing test convinced that they had hearing loss. And by all the symptoms they described, they did. However, when I completed the diagnostic testing, their ears were working perfectly. However, I didn't have the tools to be able to test APD where I was working previously. But I knew, based on what I had studied in my master's and doctoral courses, that this was likely what the patient's concerns were, but I had no way to provide the testing needed to diagnose APD. So while I was preparing to open up my new clinic, I made sure that I had all those materials, that we had everything we needed, and so shortly after we opened, I began to see patients for APD testing, and we've been providing this service for almost 6 years. As I've seen more and more patients with this problem, I've realized that there are many that need answers to why they struggle. Helping patients learn how their brain uses sounds and what can be done to improve their situation is both humbling and gratifying. To begin, I want to help you understand what this disorder is. So auditory processing refers to what our brainstem and brain do with the sound that our ears receive. A disorder is an abnormal condition or a disruption of normal function. People who have difficulty processing sound have normal ear function, but the way that the brain interprets the sound is not working in a normal fashion. Another way to describe this is that people who have auditory processing disorder have difficulties despite having normal hearing sensitivity, but their brain struggles to interpret, organize, and remember what is said, especially in background noise. So what are these processing skills that people are struggling with? First, localization is the ability to tell where sounds are coming from. It's really important for knowing where we are. It's critical for being able to sort background noise, and the brainstem is a really critical part in making this skill work. Second is decoding. That's being able to identify different sounds and types and patterns and be able to know what they mean. It's a critical skill for learning language. Another auditory processing skill is temporal processing. That's identifying timing and pitches. That's really important with understanding a lot of the nonverbal parts of communication, like someone's tone of voice, and also understanding music. Integration is taking sounds coming from the two ears and putting everything together. And then finally, tolerance fading memory. This is the ability to sort through competing noise or sounds and remembering what was being said or heard. It's really important to keep in mind that these skills are not necessarily independent. They work in different combinations to help a person hear what is happening around them and understand what all of that means. So let's quickly review how we hear. remember that it's the brain that really does the listening. Even when we're sleeping, our brain is listening to what's happening around us to know that we're safe and to protect us. The brain is what attaches meaning to sound. So the ears are the conductors, but it's the brain that uses that sound and makes meaning out of it. The brain is what identifies where sounds are coming from, and the brain helps sort out the target sound source from what the background noise is, and so all of this works together in the brain. So functionally, the outer ear is divided into 3 parts for anatomical purposes. We have the outer ear, that's the collector that directs sound down the ear canal. You have the middle ear that amplifies sound and further directs everything to the inner ear and helps protect the inner ear from loud sounds. And then the inner ear sorts sounds by frequency. It changes everything from a mechanical signal into an electrical one that the brain can then interpret. Then things get really complicated. Sound travels from the inner ear up the 7th cranial nerve to the brainstem and eventually to the temporal region of the brain. And the brain uses those timing cues down to milliseconds to help us determine several things. First, where's the sound coming from? Second, being able to squelch is being able to turn something down. So the ability that your child has to watch TV and say, I want to watch this show and ignore mom, that's binaural squelch. Binaural summation, that's how the 2 ears add things together and literally make things louder by summing the 2 things together. And then fourth, sorting background noise from the desired signal. So really powerful things are happening at the level of the brainstem and then up into the brain. So a question I get a lot are, what are the symptoms of someone who has APD? First, often they feel confused in noisy places. It's really difficult for them to sort out what they are trying to hear from everything else around them. They're easily distracted. It's hard for them to sort again, and so it's easy to get pushed one way or the other. Along with that, they become easily flustered or confused. They're often forgetful. They often have difficulty with reading and or spelling. They tend to be messy and to lose things, disorganized. Oftentimes they mix up speech sounds. They often need a quiet place to study. They often ask what. Their responses are slow or delayed. They often have a short attention span. You'd call them a visual learner. They can see, if you show them what they're supposed to do, they can do it. But if you tell them all the steps, they get lost. They often have social difficulties. They have sensitivity to loud sounds, trouble following instructions. Often they have a history of middle ear infections as well. So how do we diagnose auditory processing disorder? First, we have to rule out even a mild hearing loss. Any degree of hearing loss by default causes auditory processing concerns. So anytime the brain's not getting that full signal, there's some processing things going on. After we know that the peripheral hearing is normal, so the ear and the middle ear, everything's working together to send stuff up to the brain, then we do a series of tests to determine how the brain is using sounds with both words and with different sound signals in quiet and in noise. Originally, these tests were designed to help find brain tumors before we could do an MRI. And they target specific centers in the brain for language and speech, memory, and comprehension. So in younger children, we also supplement regular test battery with a fun interactive test using an iPad. The test is called Acoustic Pioneer, and it was designed by an audiologist named Matthew Barker. And it's a great tool to use both for diagnostics and also for measuring progress with therapy. And it's fun for kids. It's challenging, but it's really fun because it's using something that they're familiar with. Most kids have played a video game before, and so it's something comforting and easy for them to latch onto and work with. So APD treatment depends upon which areas of processing are being affected. So for younger kids, we're able to provide access to 2 different therapy apps from the same developer who came up with Acoustic Pioneer. These apps are a great way to practice dichotic listening and temporal processing, and the best part is they report back to me the progress of the kiddos and how they're doing. And so that's one way we can do therapy. For older teens and adults, therapy also includes listening skills, strengthening weaknesses. And treatment plans should also include behavioral adaptations at home, at school, or work. And that may also include using technology like FM systems, and in some cases, even hearing aids are helpful. So I want you to know that auditory processing disorder is a real thing. And the best part is it's treatable. It's something we can do something about. It causes a lot of frustration. I know of adults who have gone through most of their childhood and learning years struggling unnecessarily because they've had this underlying processing disorder. Licensed audiologists are the professionals who are trained to diagnose APD, and they can also provide treatment depending on your insurance and other considerations. Please reach out if you have any questions. We're here to help. There is hope, and there are answers. Sometimes it just takes asking the right questions and getting those answers that you've been looking for, and having that peace of mind of knowing there's something there and knowing that there's something that can be done that makes all the difference. So as I said before, we are a full-service audiology clinic located in Rupert, Idaho, just north of Minidoka Memorial Hospital. We provide hearing evaluations and treatment. This includes the latest hearing technology, including cochlear implants. We provide tinnitus evaluations and treatment. Hearing rehabilitation classes to help you be a better listener. Those will get started later this summer. Pediatric services. We take care of every age, from newborn babies who have failed their newborn hearing screening up to our oldest veterans that we just adore having come to our clinic. Auditory processing disorder, as we've been talking, cerumen management, removing wax from your ears, hearing protection and custom ear applications, and hearing aid repairs are also provided at our clinic. So I want to thank you for joining me today. Please reach out. You can email me at info@mountharrisonaudiology.com. You can visit our website to schedule a free online or phone consultation, or in person as our clinic starts ramping back up after COVID. You can also request a copy of the little book I wrote, Communication Tips for Happier Relationships. It's a guide to help people who have hearing loss, or the loved ones who know that they have a hearing loss, how to cope until you get treatment taken care of. So again, thank you and have a lovely day.